Our next recipient is Dr. Ronald Holt. Dr. Ronald Holt, please come up.
So Dr. Holt, I've also known for a bit. He came and presented at the center last year, and he really impressed us by his dedication to gay men's issues. But the long and short of it is, his passion for improving health equity, decreasing health disparities, and increasing cultural awareness in LGBT health is evident by his strong ongoing contributions. Since 2010, Dr. Holt, a clinical psychiatrist at the Kaiser's South San Francisco Medical Center, has championed national and international clinical education on LGBT healthcare. He truly has championed it. For over 1,200 physicians and clinicians all over the United States. In 2012, his website, audacityofpride.com, which he shared today, was expanded to allow providers and patients better access to his message on LGBT health awareness and access to medical resources on LGBT health, vital community support for LGBT member issues, and assistance with helping their families understand their experiences. Dr. Holt.
Thank you very much. It's an honor to be in front of you today. It's very humbling, actually, to be recognized by people who work with me day by day to try to help those who are struggling with their sexual orientation or gender identity. So it's a great, great honor. For the past 13 years, in addition to doing CME work, I've also been doing some community service by going back to colleges in rural areas to talk to students about the coming out process and that it's okay to be gay, lesbian, bisexual, or transgender. There's nothing more rewarding for me than getting these emails that I get from kids from around the country and even the world that have either seen me through a presentation or have seen my stuff on social media. I'd like to share two of those comments that I have received last year, which actually now have become a part of me. And the first one comes from a 17-year-old gay male who wrote, "Good evening, I am a gay young male. I have not been to any of your conferences, but I did see your video on YouTube and would like to personally thank you. I wish someone like you came and told me that being gay is okay a lot sooner than I found out. I told my mother I was gay at age 15. I have been living alone ever since, working full-time, all because I was gay. Something so small can really change the way that people view you. So thank you very much for helping and educating others on the problems of gay hate. I really do appreciate it." The second comment came from a 23-year-old medical student after he heard me present on LGBT health in the Midwest. He wrote, "Being a gay male, I found this talk extremely helpful. I am not to my peers, but still worry about judgment within the profession and with patients. This also will influence me as a patient when talking to my own personal doctors. After recently seeing a doctor about a personal matter, my biggest concern was talking to the doctor about my own sexuality." Unquote. These comments are not scenarios where how we can somehow impact them. These are real-life examples of the communities that we serve. These comments are examples of how we can help others through compassion, mentoring, and education. If we cannot provide culturally competent care to our most vulnerable members now, how can we expect them to later provide the care to us? We have each been blessed with knowledge, skills, and abilities that can be used to help others. Providing health equity, ending healthcare disparities, and treating all members as equals is not just a healthcare right, it's a civil right. Harvey Milk once said, "Hope will never be silent, and neither should we." Martin Luther King Jr. said it best, "Our lives begin to end the day that we become silent about things that matter. Injustice anywhere is a threat to justice everywhere. In the end, we will remember not the words of our enemies, but the silence of our friends."